My name is Dr. Geoffrey Mutuma. I'm a pathologist, and today I want to talk about H. pylori. I want to talk about H. pylori. H. pylori is a bacteria which affects or infects the stomach. H. pylori nowadays is becoming very, very common infection to the stomach, and it causes peptic ulcers. Peptic ulcer is very common in people now, and before it used to be common in adults, but we are seeing H. pylori in children even from the age of 5 years, 10 years, they already have problem with the stomach. When somebody has got H. pylori, what happens is that there's a lot of acidity in the stomach. When there's acidity in the stomach, what happens is that actually the stomach gets eroded, so that the covering of the stomach actually it is removed, or the outer covering of the stomach is removed, or somebody has got what we call peptic ulcer or stomach ulcers, and this somebody starts having pain in the stomach. This pain in the stomach, it has got three presentations. First is that there's pain when you get when you're not eating, and there's a pain when you get when you are eating, or there's a pain also which you get after you have eaten, and there's a pain which you get any time of the day or particular times of the day. And normally the people call it stomach ulcers, so we call it heartburns. Heartburns is when you are having you are just normal, and then you get something burning up here in epigastric pain around the upper part of the abdomen or upper part of the stomach. This H. pylori, it was not there before in Kenya. I remember when I was studying my research in Cambridge, H. pylori is very rare in Kenya, but now it's very common, and we are getting almost 90% who have got pain in the stomach. When we test them, they normally have H. pylori positive. So it means that stomach ulcers is directly related to actually H. pylori infection. The same thing is that H. pylori is a risk factor for cancer of the stomach, and that's why that cancer of the stomach now is rising very high in Kenya. Is number 4 in women and number 3 in men. It means that because of high infections of H. pylori in Kenya, we have also high rates of having cancer of the stomach in Kenya, and that's why H. pylori is directly connected to peptic ulcers or stomach ulcers, and directly connected to cancer of the stomach. So H. pylori is a serious infection, and most people have it, and that's why I found that most people nowadays they say that they don't eat onions, they don't eat beans, they don't eat kales, they don't eat sukuma wikis, and they don't eat pilipili, because once you eat those foods which have got a bit of taste or a bit of bitter taste, they decrease the acidity in the stomach, and that acidity makes somebody to have a lot of pain. And most of the pain of people who have got peptic ulcers or stomach ulcers, it normally comes late in the night at around 2 or 3 a.m. So that you wake up and there's a lot of pain. Most cases with this pain, when you take something like milk, it goes away, or something like Actor. And nowadays, patients, they are used to taking omeprazole. They normally call it Omes. Some people tell me, Dr. I'm taking Omes when I've got this pain. Don't take omeprazole for a long time. Don't take antacid for a long time. Don't take the milk for a long time, because when you take these remedies, the pain will go. Or when you avoid eating some food, the pain will go, and you'll not be having that pain. It means that the ulcer is there, the ulcer is progressive, but you are not having signs and symptoms. And then after some time, this ulcer, not sometimes because a given time between 3 and 7 years, these ulcers convert to be cancers, and that's why cancer of the stomach is very common. So once you have hyperacidity, your cancer of the stomach, is good to be checked and be treated for the ulcer. Now, we normally, for treatment of the H. pylori, for treatment of the ulcer of the stomach, we normally use what we call proton inhibitors, and this mainly you give them 3 types of drugs. You give omeprazole, you give flagyl or tinidazole, and you give antibiotic, either augmentin, or you give ampicillin, or you give a drug which can kill the bacteria itself. So it means that to treat well, you need to take these 3 drugs at once at a given time. And then what we have seen, that once you take these drugs, actually they don't clear the H. pylori in one dose. You have to repeat the second dose. Sometimes you treat the third dose. What is very important, make sure that you have taken this drug and the H. pylori is completely cleared because once you leave it uncleared, it won't be very good. Nowadays, we are having what we call cleanse. Cleanse is a new product, which is a natural product, which we are giving to our patient, and this one clears the H. pylori and is a natural product. It has no chemicals. And that's why what we're giving for this month of April, we're giving the people, and after 10 days, your H. pylori, your constipation, your gas is actually cleared completely. And this is actually what we are giving our patients nowadays. And if you need this product, just ring me and I'll be able to get the product. The product goes at 2,850. This includes buying the product and delivering the product. We can deliver the product wherever you are. And this cleanse is actually a very good product. We got it from US and it's doing very good for the patient who have been having peptic ulcers, patient who have been having gas, patient who have been having constipation, and also patient who have been having arthritis too. And this is a presentation of people who have got H. pylori. Thank you very much for watching our YouTube channel this time. Asante sana.